so the state of emergency will end in February. So this will give us enough time to address whatever issues come right now between now and that February date. So if there are any surges, we're going to be in a situation where we can reassess and go forward. But really at this point, what we need to remember to keep doing is to immunize ourselves to be able to get that booster, get our flu shot, and continue those hygiene practices that we've all adopted, which are washing your hands and avoiding touching your faces. That's the easiest thing that we can do right now.
After February 28th, though, is the state still prepared for a potential influx or surge?
So we have to see where we're going to be at that point. And so I think this lead time that we have between now and February will give us that ability and that cushion to reassess if necessary.
Now, in my research leading up to this interview, I learned that only four states in total, including California, have this role of a state surgeon general. The other big one is the Florida Surgeon General, and he has become a very political figure, telling young male adults not to get the COVID vaccine, talking about how the state is never going to require young kids to get the vaccine to go to school. What are your thoughts on those decisions, and what impact do you believe they have?
So I can't tell you anything about what the Florida Surgeon General is saying, but what I can tell you is that here in California, we know that vaccines can make a difference. We know that the boosters can make a difference. You could take, for example, the Hispanic population. When the Hispanic population initially was not getting the boosters, we saw that they had the highest number of hospitalizations, highest number of deaths, and unfortunately the highest number of comorbidities like high blood pressure, diabetes, so that when they got the COVID infection, they did worse. As we started to get the number of Hispanic population more vaccinated, we saw those death rates decrease. We saw the decrease in the hospitalization. So we know what works. And so here in California, what we're doing is we're advocating for what works, and that is the booster vaccine. Always, always, always though, we encourage you to speak to your healthcare provider and reassess and inform yourself based upon your own personal health and your personal circumstance, what is best for you.
Do you believe that California should require young kids to get the COVID vaccine in order to attend school?
So I think we already have made that decision. And right now the stance is no. What we are encouraging and recommending is that booster. And to know that the booster vaccine is available for 5 kids 5 years and above. And going to myturn.gov, it really is a place where folks can go and find out where the COVID vaccine is available. To date, now we have over 2 million Californians that have been vaccinated.
What would you say to Californians who are wary? I know you said you don't follow necessarily what the Florida Surgeon General is doing, but his one tweet saying to young men that they have a higher risk of heart attacks from the COVID vaccine had over 50,000 shares, a lot of viewership. People in California do read things like that. What is your message to them?
My message is we have to look at the science. We have to look at the outcomes that we've seen, and we have to look to see what's been reported. And honestly, the science shows that overall what our outcomes are in getting the vaccine is keeping people out of the hospital and reducing the deaths in those who would be ending in the hospital. So I would say look at the data, look at the science, and then reassess. Speak to your doctor if you have a concern, if there's a medical issue that you personally have. Speak to your healthcare provider. I think that is probably going to be the most important thing that folks do. Instead of following a tweet, speak to somebody that knows your health, that can look at your medical record and advise you.
Let's talk about RSV, because a lot of parents are concerned right now. What does it look like in California? Are hospitals prepared?
Well, RSV is respiratory syncytial virus, and it's an infectious disease. And basically, we want to continue following the great hygiene practices that we've all adopted during COVID. And that is really, again, washing our hands, not touching our face, and if somebody is sick, stay away from them.
Mental health is a really big topic in California, and I saw on your website that it's one of the 3 areas of focus for you. Why is that?
That's right. So mental health is critically important. We know even before the pandemic that mental health was an issue that was impacting our kids, impacting our youth, the high school kids and college kids. And after COVID, after being in a virtual environment for close to 2.5 years, it's really taken a toll not only on our kids, but the adults as well, the caretakers. We know that about 1 in 5 people in the United States have some type of mental health issue. And so really bringing to light all of the investments that are occurring here in California is critically important. So mental health is one of my initiatives. The governor has signed over $4.7 billion to reimagine what mental health is going to look like for our children and our youth. So that's from ages 0 up to 25, to be able to provide resources, listening to the population of what they want, how they want it, when they want it. So we're creating resources, a web-based platform that's going to provide those resources, to the kids, and we're also providing support to the parents, to the teachers, wherever a child, anyone from 0 to 25 happens to be, to provide support to all of those around them to help that person. Now, that it doesn't stop there, because the CalAIM initiative, which is the Medi-Cal program, is also incorporating a whole person initiative. So we want to be sure that wherever a person goes, the mental health piece is in there, and realizing that mental health sets the trajectory for substance abuse, for overeating, for drugs, for alcohol, because you want to self-medicate when you're not feeling well, when you're stressed and you're anxious. So addressing that is one way that we can try and curb all of the other negative consequences.